This is a demonstration of the supplies that are needed to give a high volume enema at home and how to use them. First, let me show you the supplies that you will need. A large silicone catheter with a 30 cc balloon. This catheter is reusable, and I'll show you how to clean it after the enema is given. A syringe to fill the balloon with air between 15 and 30 cc's as ordered by your surgeon. Lubricant to make passing the catheter easier. These can be purchased in large tubes. A bag to hold the water or saline as ordered by your surgeon. This is a feeding bag. We find that these work very well, but you can use enema bags that you purchase in the drugstore as long as you can make the end of the tube from the bag fit with the end of the catheter. And a large, wide-tip syringe to use for cleaning the catheter after the enema is done. These supplies will be ordered for you by the nurse in the surgery practice. Now let me show you how to use the supplies. Take your feeding bag or your enema bag and hang it in the bathroom within reach of your child. Close the clamp if you have a clamp on the bag. If you don't have a clamp on the bag, you can use a clamp of this type. Now you're ready to fill the bag with water. You'll use water or saline as ordered by your surgeon. Now the bag is full of water. You'll use the amount of water as ordered by your surgeon. For these demonstration purposes, we're using 500 milliliters of water. The next thing you need to do is you need to run the water through the tubing so there's no air in the tubing, just water. In this case, we're going to release the roller clamp and let the water slowly move through the tubing so that all of the air is out. You can run this into the bathtub or sink, whatever's handy. The next thing to do is check to make sure that the balloon works. You'll inflate it with between 15 and 30 milliliters of air based on what your surgeon orders. And this is how it will look when it's inflated. Now position your child on the floor of the bathroom, either side lying or in the knee-chest position, and make sure that he or she is comfortable. They might need a pillow under their head. Now with your child in the position that he or she is comfortable with on the floor, lubricate the catheter. I recommend putting a small amount on a piece of tissue, rotating the catheter in the lubricant so it's much more comfortable to be inserted, like this. Now that the catheter is lubricated, you're going to insert the catheter into your child's anus. You need to insert it several inches beyond where the balloon ends, so about here. Once the catheter is in place in the anus, you can inflate the balloon with the syringe, filling it with air to the recommended amount. And then you'll need to take the catheter and pull it back to the anal muscle where it stops and seals the anus so that you can infuse the water for the enema and not lose any water during the infusion. So now the catheter is in your child's anal opening with the balloon inflated and it's pulled back against the anus so the balloon fits snugly in place. Take the end of the catheter and connect it to the feeding bag so that the water can infuse through here. You'll go to the bag and either release the clamp, if that's what you're using to close the tubing, or the roller, that's what you're using to close the tubing, and open it like this and let the water flow in over 5 to 10 minutes. Now that you've opened the clamp and you're letting water flow through the catheter into your child, take approximately 5 to 10 minutes to allow all the water to drain from the bag. Have your child hold the water in his or her colon for 15 minutes and use a timer. After 15 minutes, you'll ask your child to move from the floor to the toilet, but you're going to leave the catheter in place connected to the tubing of the feeding bag. After your child has moved from the floor to sitting on the toilet, the way to deflate the balloon is this. Attach the syringe to the balloon port. Pull back and take out all of the air that you put in earlier. When you do this, the catheter will fall out of the anus into the toilet. You can take it out and set it aside. Both of those things aside, and instruct your child to sit on the toilet for 30 minutes, pushing off and on. Use a timer. Let me show you a good way to clean the catheter after the enema so when you store it, it's free of stool. Use a syringe that's wide-tipped like this one is. Place it on the end of the catheter like this. Put the other end of the catheter down into the water of the toilet and use this syringe to pull water into the catheter and push it out of the catheter. And you can repeat that as many times as is necessary until the tube is clean and free of stool, and you can put it aside for your use the next day. When you're storing this large syringe between uses, I recommend that you take the plunger out and store it this way. That way it's dry between uses.